Leanne. Ms. Leanne Matthews is joining us this morning to talk about some of the things Baptist Community Services has done, especially when it comes to caring of our aged loved ones. Now, you look out across the landscape and we see the large number of that generation entering this time frame. So we have to make allowances and we have to be prepared for that stage of life as that number grows. Ladies, welcome to the show. How are y'all doing today?
We're
Good morning.
good.
Good morning.
Now, fill us in. Let us know, what are some of the things, the needs that the aging population needs that Baptist Community Services can reach?
Marcy.
The needs, they need socialization, they need safety, they need security, they need stability, and those are some things that we provide here at Park Central.
So specifically at Park Central, you're talking about, keeping them engaged, keeping them involved. Plus, there's also the issue of, medical care and things like that. Speak to us about, the different types of care that they could receive at your facility.
Yes, we love that question. We have in independent living, we have a nurse navigator that helps follow them as things start changing, if they have an event or anything like that. And then we can transition them into higher levels of care with assisted living, long-term care, memory care. We also partner with Compassion at Home, so we can try to keep them in their independent living as long as we can. So we can transition them through the last stages of life all the way through.
One of the things that I'm very curious about, when we're talking about stabilizing at home, that has to include other family members too. Do they go through a training for this or what?
We guide them in this transition, into the next chapters of life. There's many different changes, and so we are there to support the family members, to give them the pieces of the puzzle, to help them feel secure in what's coming about and how we're going to help them as a family with their loved one here at Park Central.
One of the big things you said in that statement was the socialization, and we've seen in studies and I've seen in personal life, when people tend to withdraw, it makes things more difficult. They don't keep up with their medications, they don't eat regularly, but we see that a lot in the elderly, especially if a spouse has passed on or something. The withdrawal, how important is that socialization and being in that community for the folks at Park Central?
It's very important. That's a good question. It's very important because it even helps with their cognitive, to keep it going throughout. And, meals are nutritious, so it helps with the body. It helps with their function. That socialization during COVID, when they didn't have it. So that's when we've seen that it's really, really important. It keeps them functioning. It keeps their minds going. It keeps them engaged into life, and it actually helps with their memory along the way.
How do you start this conversation? Because for years, the idea of a place like this had a certain stigma. And certain people would have, I'm too young for the old folks home. You really kind of changed that on its ear. It doesn't have that stigma of the old folks home anymore, does it?
Well, and at where it is very home-like, we do what we call small house concept. So each house will hold 12 to 15 residents. So it's more home-like, it's more intimate. In all of our buildings, we've kind of changed that whole aesthetic to make it look more like a home and not a facility.
One of the things I'm kind of interested in, since COVID itself, how has that increased or changed your ways of going about treating the elderly along the lines?
With COVID, we saw so many different things, such as the socialization aspect, because initially everybody was terrified, not certain what was going to transpire. But we did recognize the fact that we still needed that opportunity to be able to socialize the withdrawal that was happening during COVID. So we take that very seriously. We go in and we have implemented, new activities and various different ways of socializing, to keep them engaged. Just like at meal times, whenever, they get together and they have their meals together, they have a tendency to linger longer. So if they're going to linger longer, they're going to enjoy those meals and probably eat a little more. But at Park Central, we wouldn't want to.
And to add to that question, we are an evolving community. We
Right.
have a gym here, so they can work out. We have the gym here on location. We have we're evolving. We're changing things to the new evolving seniors of the day because they're getting younger. We call them aging younger. So we have different things that they can do here on campus.
And we also do the best friends approach, which is the staff gets to know the person who they were, not necessarily the disease process or the dementia or anything like that. So they know how they like their coffee. They know their interests. So I feel like that kind of, especially during COVID, we got to still honor those people, even though their families weren't around. The staff took up that spot best that they could.
Go ahead, Ron.
We have more time. Okay.
Yes.
We've used the word socialization a lot, and so that makes me think. You guys have access to specialists. Maybe a person that deals with just mental health, and you mentioned the workout, so you probably have someone trained. Maybe an exercise physiologist or somebody like that. But you guys really have access to anybody that's needed. If I'm right here, to take care of the individual needs of each person.
Yes, or we're going to be the resource. We're going to go find what you need. We're gonna go to work. We're going to do what we can to make you whole and make you healthy. So if that means that we have to go pound the pavement and find somebody who can come into the building, that's what we do.
How can we find out more about Park Central and becoming a part of this community?
They can always go to our website, parkcentral.org. They can give us a call, 806-337-5700. We're always here to help. Even if, something transpires and they're not quite ready yet, we are the resource for them.
Park
Even
Central.
if we can't help them here on our campus, we can refer out. We can help guide people. I think that's really important because we don't know what we don't know till you need to know it. And then people are like, I don't know what to do. Kids are like, I don't know the first step. So we can help guide them, whether it's here to us or it's somewhere else in the community. We're just a good resource.
I think is a great way to look at it is it's not an ending. It's really truly a new beginning with
Right.
Park Central. It's a new phase of life, and give those folks a call. They can help you out in that transition of life. If you're a caregiver, if you're a child of someone who's ranging in that age, but now it's not just for the old and infirmed. We got younger and younger seniors taking part and still living active, full lives. Ladies, thank you for being a part of our show today.
Thank you.
you.
You're welcome. We got to get out of here. You know the 2 rules. Be kind, be careful. We'll see you bright and early tomorrow morning right here on The Chat.